Hi, my name is Kaylin. I'm going to be your nurse today. Can you go ahead and tell me your name?
My name is Emma Thomas.
Can you tell me your date of birth?
I was born on July 6, 2000.
Okay. Well, hi, Emma. What we're going to be doing today is a head-to-toe assessment. It's basically, I'm just going to be like looking from your head to your toes all the way throughout, just assessing your body for like different things. It might be like a little bit of a lengthy process. Do you need to go to the bathroom or anything before we start?
No, I'm good, thank you.
Okay. So when I first noticed when you walked in the door was you had a nice even gait. You didn't seem, you had a good balance. Didn't seem to have any problems walking or anything like that. Your appearance seems to be clean, orderly. I don't notice any like abnormal smells or anything. Your posture is erect, so that is good. Your behavior seems to be appropriate to the situation. You are alert and your speech is clear. Can you tell me where you're at today?
I'm at my home.
Do you know what day of the week it is?
It's Monday.
Do you know what year it is?
It's 2020.
So the client is A&O times 3. Can you, I have another question. If a car with red and blue lights came on behind you, what would you do?
I would pull over.
Okay, so abstract reasoning is intact. So normally at this point, next thing I would do is check your vital signs, which would be like your temperature, your pulse, your respiratory rate, and your blood pressure. But since we have already done that, there will be like no need for me to do that. I'm going to just scoot a bit that way, so. Sorry, so she can see me better. Okay, so yes, we won't have to do vital signs today. So next thing I'm going to do is I'm just going to take a look at your face. Your face seems to be symmetric. It seems to be midline on your body. It's proportional to the rest of your body. You don't seem to have any like problems or like leaning to any sides or anything. But yes, your eyes, ears, everything seems to be symmetric. Just gonna like feel throughout your face. Temperature seems to be even throughout. Color is even throughout. And so next thing I'm gonna do is like feel around on your head. So the skull itself seems to be round. I don't feel any lumps or any abnormalities. I'm just gonna palpate and look. The scalp doesn't seem to have any dryness or anything to it. Don't see any lesions or anything like that. So next thing I'm going to do is palpate your frontal sinuses and your maxillary sinuses. Just let me know if there's any pain or tenderness. Do you have any pain or tenderness with that?
No.
Okay. So next thing I'm going to do is look at your eyes. So you can go ahead and close your eyes for me for a second. So the lids of her eyes seem to be nice and smooth, no lesions or anything present. You can open them back up. Your eyelashes come out and upward, so none of them are poking into her eyes. Her sclera is nice and white. I don't see any like arteries and veins like explode or anything like in her eyes. There's no like redness or anything. I'm gonna look at your conjunctiva. Just pull it down some. Seems to be nice and pink. Doesn't seem to have any signs of an infection. So next thing I'm gonna get you to do is read off this card. I'm gonna get you.
Sorry.
I'm so sorry. I'm gonna get you to hold the card 12 to 14 inches from your face, and then I'm gonna get you to do it first with both eyes open, and then with one of your eyes. So you can go ahead.
EEKAB 942.
It is 20/20 with both eyes open, so you can go ahead and do it with one eye.
EEKAB 942.
So it is 20/20 in her right eye, so you can go ahead and do it with the other one.
EEKAB 942.
So it's 20/20 in her left eye. Alright. And so next thing I'm going to do is test your direct and consensual light reflex. Normally I would do this with a pen light, but my pen light is not working, and the other one I have working is in Murray, and I don't have time to get to drive to Murray. And so I have like a small kind of dull flashlight just for us to use. First thing I'm going to do is note the size of your pupils. They're about 4 millimeters, actually like 5 millimeters on both sides. So next thing I'm going to do is test your direct and consensual light reflex. So I'm just going to get you to Alright, so the eyes are Perla, and the eyes are Perla, So next thing I'm going to do is test for your accommodation. So I want you to look at my finger, and then I want you to look at the wall. Alright, so the eyes are able to accommodate. Normally here I would use the ophthalmoscope to look at her red light reflex, but I do not have one. So we would look at it, and it has like a light that would zoom in. I would look inside her eye, and you would see the reflex on her retina, and I would do that with both eyes. So the next thing I'm going to do is look at your nose. So your nose seems to be symmetric on your face. I don't see any abnormalities or anything like that. I don't see any sort of like deviation. It's nice and midline. So what I'm going to get you to do first is check the patency of your nose. I'm going to get you to go. So you're going to do that. Alright, so her nose is patent. And so next thing I'm going to do is get my light, and I'm going to look into your nose, and I'm going to like look at the mucus and your turbinates and stuff, and see in there. So you can lean your head a little bit back for me. Alright, so her septum seems to be midline. I don't see any sort of deviation. Turbinates are nice dark pink. The rest, mucus and everything, all the membranes seem to be a nice pink color, so no problems with that. So next thing I'm going to get you to do is I'm going to look inside your mouth. So first, your lips, they seem to be a nice pink color. I don't see any dryness, crustiness, any sort of lesions or anything like that. So normally we would use a tongue depressor. I do not have a tongue depressor, so we're using the back of the spoon. I'm going to get you to smile real big for me. Her gums seem to be nice and pink. Her teeth don't seem to have any like infections or anything in them. Her teeth are nice and white. And then I'm going to get you to open your mouth and stick your tongue out and say, ah. Her uvula rises. You don't have to say anything. Her tonsils are about, I'd say kind of a +2. The rest of her mouth, mucus, mucosa, tongue, all that's nice pink color. I don't notice any lesions or abnormalities of the sort. So that's good. Next thing I'm going to get you to do is I'm going to get you to take a sip of this water, because we're going to check your thyroid. So I'm going to have you take a sip, and when I say swallow, swallow. Alright, so her thyroid is movable when she swallows, and the patient is also able to swallow. So next thing I'm going to do is I'm just going to palpate your trachea. It seems to be midline. Do you have any pain or tenderness with that?
No.
Doesn't seem to have any problems, no deviations, so that's good. I don't see any JVD present. Next thing I'm going to do is palpate the carotid arteries. So the amplitude seems to be a +2. The rhythm's nice and smooth, no abnormal beats. Let me check the other side. So the amplitude is also +2 on this side. Again, the rhythm's nice, smooth, no abnormal beats or stuff like that. So I'm going to auscultate for a Bruby. Alright, so no bruise are present. Next thing I'm going to do is I'm going to look in your ears. So normally I would have an otoscope for this, but I do not. First thing I'm going to do then is palpate your ears, so let me know if you have any pain or tenderness. Do you have any pain or tenderness with that?
No.
Alright, so like I said, normally we would have an otoscope. So I'll just describe normally what I would do. So the otoscope would be turned kind of upside down. And when you go to look in the ear, you would pull the ear up and back. And when you point the otoscope with the biggest end piece on it, you would point it like kind of towards her nose. And then inside the ear canal, it would be somewhat pink. There's probably some hairs through there. There's some cerumen present, which is like earwax. And then once I could see the tympanic membrane, it'd be a nice pearly gray with the conal light on it. So I'm sure that you have that on both sides. I would check it if we could. And so next thing I'm going to do is palpate your lymph nodes. So here's your preauricular, post-auricular, occipital, and come back to the front. Here's your tonsillar, submandibular, submental. Here's your posterior cervical, deep cervical, superficial cervical. And then normally the patient would have a gown on and I wouldn't palpate through her shirt, but here's your subclavicular and infraclavicular lymph nodes. So none of the lymph nodes are palpable, which is good. And so the next thing I'm going to do is go down to your upper extremities, which is like your arms. So first thing I'm going to do is just palpate, feel it. Skin color seems to be even throughout. Temperature also seems to be even throughout. No edema seems to be present. Check skin turgor. Seems to be no tinting, so that's good. And then I'm going to check your capillary refill. Capillary refill seems to be less than 2 seconds. And so next thing I'm going to do is I'm going to have you put your arm up and I'm going to palpate through your shirt. Normally she would have a hospital gown on and be a little easier to get to it, but I don't want to have to like make her move her sleeve all weird. So here's your central lymph node right in the middle here. Your subscapular, which is kind of like towards your back, your lymph nodes. You have your pectoral lymph nodes, and I already said the infraclavicular lymph nodes. And then your lateral. So none of the lymph nodes are present on that side. I'm going to go over and do the same on this side. So there seems to be the central, pectoral, subscapular, and the lateral. So again, no lymph nodes are palpable. So next time I get to do, I'm gonna have you like kind of turn around on the end of your bed-ish, so I can look at your back and see, make sure you're in the video. So normally, she would be able to turn. Yeah, there we go. So normally she would have a hospital gown on, and we would be able to like fully see her back. I don't want her to have to like lift her shirt up, and so normally I'd be able to see that the color. Skin color is even throughout. I would feel that the temperature is also even throughout. Sorry. I'm going to palpate the muscles. Muscles seem to be no deformities or anything present, so that's good. No like bulges or anything. And then I'm going to palpate your spine. Spinous process. So again, no bulges or anything in her spine. Seems to be midline. I don't see any deviations or anything. Things seem to be symmetric. So next what I'm going to do is I'm going to percuss down her back. So resonance is heard throughout. So next thing I'm going to do is listen for her breath sounds, and what I'm going to get you to do, Emma, is I'm going to get you to breathe through your mouth. That way it'll be easier to notice or listen to your breath sounds. Alright? Again, no abnormal breath sounds. If she was wearing a gown, we would not do that over a t-shirt. So Next thing I'm gonna do is check for CVA tenderness. So I'm gonna like tap on your back and let me know if there's any pain or tenderness.
Look-wise, I feel
Any pain or tenderness?
No.
Okay. And then I want to, her AP diameter is about a 2 to 1. And then I'm going to check for symmetrical chest expansion. So I'm going to just take a breath in and then out. So the chest, when she breathes, everything, her lungs can expand symmetrically. So I'm going to get you to turn back around this way for me. Okay. So again, normally she would have a gown on. I'd be able to see her skin better, but here I don't want you to have to like take your shirt off or anything. So her skin color would be even throughout. Her temperature is also even throughout. I noticed that her chest rises in like a normal rhythm. Doesn't seem to have any trouble breathing. I don't see any abnormal like one-sidedness or anything. And so next thing I'm going to do is listen for the breath sounds on her front side. And go through your mouth. Alright, so on the front side, I don't seem to hear any abnormal like crackling or anything like that. So breath sounds are clear posteriorly and anteriorly. So next thing we're going to do is listen to your heart. So I'm going to kind of get you to lay down with me. So I think that's how we do it. So what I'm going to do is feel around your precordium. I'm just going to feel for any heaves or abnormal lifting and stuff like that. Her apical pulse seems to be at the mid-clavicular line at the 5th intercostal space. And so what I'm going to do next is listen to her heart sounds. I'm going to name them off before I listen to them so I don't get confused. So at her right sternal border, 2nd intercostal space is her aortic valve. Left sternal border, 2nd intercostal space is her pulmonary valve. Left sternal border, 3rd intercostal space is her Erb's point. Left sternal border, 4th intercostal space is tricuspid valve. Mid-clavicular line, 5th intercostal space is the mitral valve and where the PMI will be. So I'm going to listen to it, and then when I get to the PMI, I'm going to listen for a full minute to get her at the pulse. her apical pulse is a 68. I didn't hear any abnormal sounds, but I'm going to go back over with the bell to listen for any sort of abnormalities. Alright, so no heart murmurs were heard when I went back over with the bell and my stethoscope. Again, no abnormalities or anything seems present. And so next thing I'm going to do is we're going to look at your abdomen. So I'm going to get you to lift your shirt up. And then I'm going to get you to bring your legs up a little bit. Normally, again, she would have a hospital gown on and we would get her blanket and we'd be able to like cover her lower half. So she'd feel like less exposed because normally she wouldn't have her shorts on. And so, first thing I'm going to do is I'm going to look at the skin color. It seems to be even throughout. Temperature also seems to be even throughout. I don't see any abnormal pulsation. I don't see any pulsations or any like movements or anything going on in her stomach. The contour seems to be even throughout. I don't see any like bulges in any certain like areas or anything. So what I'm going to do first is I'm going to auscultate over your stomach and listen for any gastrointestinal sounds. Alright, so sounds are present in all four quadrants. Next, I'm going to listen with the bell of my stethoscope to see if I can hear for any bruits in your aorta, your renal, and your femoral. Again, with listening to her femoral, it's going to be a little more difficult because she's in her shorts and I don't want her to have to take her shorts off. But her femoral pulse would be like right in here. And I'll just put my stethoscope on top of it. Just like with the rest of it, you normally would not do it on top of light clothing. Alright, so there seem to be no bruise present. I'm going to feel on top of your aorta to see if there's any pulsations. I don't seem to feel any abnormal pulses, so that's good. Again, with checking her femoral artery, it would be right in here. And normally if you could feel it really good without her shorts in the way, it would be a +2 amplitude, and the rhythm would more than likely be smooth, no abnormalities or anything like that. So next what I'm going to do is I'm going to light percuss over your stomach. There should be tympani heard throughout except dullness above the liver and stuff. So.
Need to wash anyway.
Alright, so tympani is heard throughout, just a little bit of dullness above the liver. So next thing I'm going to do is I'm going to lightly palpate over your stomach. Let me know if there's any sort of pain or tenderness. Any pain or tenderness? Alright, so I'm going to do a deep palpation. Again, let me know if there's any pain or tenderness. I'm assuming there's no pain or tenderness.
No.
Okay.
Oh no, I'm so sorry.
Okay, so no pain or tenderness in any of the four quadrants in light or deep palpation. So next what I'm going to do is test for rebound tenderness. So I'm just going to like push in from this side. The client does not have an appendix, so she's not going to have tenderness, but we're going to do it anyway. I'm going to push in. No pain or tenderness. Alright, so next what I'm going to get you to do is I'm going to put my hand here, and I'm going to feel for your liver border. So I'm going to get you to breathe in, and then out. So liver border was not felt, which is good. And so next time we get you to do, I'm going to get your legs down, and then I'm going to get you to like lean your head up, try to look at your toes, and we're going to look for a hernia. Alright, so no hernia is present, and so that is good. And then I believe that's on the abdomen. Normally, before I got her to lay down for the abdomen, we would start with the breast exam. I would get her to lift her arms up, and then I would get, for when she started out with her arms down. And then lift her arms up, and then have them on her hips. And then when she gets down, lay down for the abdomen exam, I would have her put her arm like behind her head, and I'd put a little pillow underneath her shoulder, and we would palpate all four quadrants of the breast, including the tail of Spence, just checking for any lumps or anything like that. And then I would teach you how to do the breast self-exam when you're at home. So it's about once a month, right after your period. You can do it like right when you get out of the shower, when you're looking in the mirror. You can do it while you're in the shower. You can do it like when you're lying down. All of those are good times to do it. Even if you can do all three, you can do in an up and down motion. Make sure to get like back in here, kind of like under your arm some, and just feel for any lumps or masses or any odd tenderness and stuff. And so that's how you do a breast self-exam. And so next what I'm going to get you to do is I'm going to look at your legs. So you can go ahead, sit up, and have your legs over the side here. So I'm just going to feel like throughout your legs. Color seems to be even throughout. Temperature seems to be even throughout. I don't see any like abnormalities. Her legs seem to be symmetric with each other. I don't see any inflammation or anything in any of her joints. There seems to be no edema is present. And so I'm going to feel her posterior tibialis pulse. It is a +2. The amplitude is a +2, and the rhythm seems to be even bilaterally. Doesn't seem to have any like abnormal beats or anything like that. So next, I'm going to check her dorsipedalis pulse. So it is +2 amplitude, and the rhythm is even bilaterally. Again, don't seem to have any like abnormal beats, nice and smooth. So now I'm going to go ahead and check her capillary refill at her toes. All of them seem to be less than 2 seconds. No skin turgor, no tinting present. I forgot to mention on her fingernails earlier, but with her toes, all the nails seem to be at a 160 degrees. I don't see any clubbing or anything present. Again, temperature and even throughout. So I'm going to check my paper now. So I didn't do the whisper test, and then I couldn't remember if I checked her radial and brachialis pulses together, so I'm just going to do that just in case. I forgot, so I'm going to do this. Her radial pulse is +2 amplitude, and the rhythm is the same bilaterally. Seems to be smooth, no abnormal pulses. I'm now going to check your brachial radialis pulse. Seems to be +2 amplitude, smooth rhythm bilaterally. And so now what I'm going to do is I'm going to do the whisper test. And so what I'm going to do is I'm going to come over here and I'm going to have you cover one ear, and then I'm going to whisper something and just let me know what I say. Okay. Okay, so go ahead and cover your other ear.
You said basketball, baseball, softball.
Yes.
You said jumping, running, swimming.
Yes. Alright, and so that's the end of my client's head to toe exam. But before we stop real quick, I just wanted to say, like, at the end when she would stand up for a male, we would do the male self-exam. And so I would teach getting tongue-tied, sorry. And so for the male, what we do, I would inspect the genitals, see if there's any like hair distribution, stuff like that, make sure there's no abnormalities, any obvious like lumps or lesions and stuff like that, hair distribution again. We would palpate the shaft of the penis, make sure there's no pain or tenderness, no lumps or abnormalities present, make sure there's no sort of discharge. We would also inspect and palpate the scrotum, feel around for the testes, vas deferens, and the epididymis. Make sure there's no pain, lumps, or tenderness in any of the scrotum. Make sure there's no abnormalities such as lesions. And I would let my patient know the best time to do this on his own at home would be once a month, and it would be probably when he would feel like getting out of the shower, it would be once a month when he's in the shower, because the hot water makes the scrotum easier to palpate and stuff like that. So definitely once a month in the shower, just palpate his scrotum, feel for any pain or tenderness or any sort of like masses he's never noticed before, and to palpate the shaft of his penis to make sure there's no like pain or tenderness there either or any abnormal discharge.